Talking about placental fetal well-being, we know that estrogens are the most important hormones for the health of a pregnancy. They are produced by placenta itself because the baby inside the womb, through its own estriol, asks for the placenta to produce estrogens. But along with the growth of glands and body fluids, estrogens will work on the brain of the mother. They will work into developing what we will see after birth, that is called the baby talk. They will work in promoting a kind of modification, emotional modification. Women will be more open to emotions. They will be crying a lot more. They will be laughing a lot more. They will be more sensitive and increase sensitiveness. They will prepare this woman, this adult, to be ready to understand the sensibility and sensitivity of a newborn baby. When that baby will be born, he will be born newborn in a world of adults. And no one of us can relate to that. No one can remember how it was to be a newborn baby. So Mother Nature provided this beautiful neuroendocrine modulation in women. Therefore, when the baby is born, there will be at least one adult able to comprehend the sensations and the emotions of a newborn baby, and this adult is mama. And we see how stress can interfere with this modification. Physiologically, in pregnancy, our fight or flight system is slowed down a bit, more than a bit. And this is to protect. It is meant to be protective of the baby and the womb, the uterus, the circulation. But what happens when stress occurs and stress gets chronic? This sometimes happens. Then we see the fight or flight system raising and the arousal getting to affect not only the circulation in the womb, so the growth of the baby and the communication of the baby through movements, but we will see how this stress intervenes in the limbic system of mother, making her more anxious and less prepared to life with the baby outside the womb if this stress goes along for quite a long time. So sometimes we cannot take the stress off of that mother. Environment means not only the physical environment or the natural environment. Environment for us as humans is relationships as well. So it's not always easy. It's not possible all the times to take that stressor out of the woman's life. So what can we do? As midwives, caregivers, doulas, families, what can we do? We can try to stop now and then that stress. We can try to and create time and space for that woman and her baby to calm down, to lower the activation of the sympathetic system or the fight or flight. We can try to promote the correct environment in which estrogens are supposed to increase the dreaming activity, like the intuition of mother, visualizing, for example, or dreaming of the baby, talking about the baby, sharing with other women the experience of bearing a child, crying together, and massage, all the tools and the simple things we know that are good for a pregnancy are even more good for a pregnancy who is starting to be at risk of some kind of pathology. And some of these techniques, some of them are really are proper techniques, some others are not. They can be more evidence-based, or they might come from culture of other parts of the world. They can become from the heritage of ancient parteras, or they can come from our family heritage. But altogether, they are a powerful tool to help women and babies during the voyage of pregnancy. And some of these I would like to offer and to share with the beautiful ladies in Israel. So I can't wait to see you guys, and see you very soon.